Hi everyone, welcome to our next presentation with Bethann Nelson today. So excited to have her with us again. This is once again part of our Care Connection series that is focusing on the fraud that comes along and scams that can come along as we age. And so she's here with us today to kind of go over what the latest scams are, what's popping up around, so that way we can be aware for ourselves as we are also aware for caregivers, the person that we are taking care of. So without further ado, Beth, I'll let you get started.
Okay. Afternoon, everyone. Glad you're here. Today, we're going to talk about protecting your healthcare identity and exploring the latest healthcare scams. So just a little background on the program. The Senior Medicare Patrol, we received a grant it's a federal grant from the U.S. Administration on Community Living to help prevent Medicare and Medicaid fraud among seniors in New York State. So their mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So our program is obviously statewide, and we have counselors and volunteers throughout all of New York State, and we do a lot of community outreach, educational presentations, and distributing information. We have a lot of volunteers who go to different senior centers or different groups, and they bring all kinds of flyers giving great information about healthcare fraud and who to contact. So our volunteers, as I said, are all over the state, and they serve as the eyes and ears of their communities and disseminate materials about the program. We also have certified, unbiased counselors who provide assistance to the public and work with the U.S. Office of the Inspector General to resolve cases. So what is fraud? Medicare fraud, I would like to mention before I even start, is right now costing New York State taxpayers over $5 billion a year. And those numbers are old, so we know that it's way more than that. Medicare fraud, though, is the intentional billing Medicare for services that were not received or billing for a service at a higher rate than justified. Abuse happens when a doctor kind of finds out that he can bill for something and Medicare will pay for it. And then it does become fraud when they know that they made a mistake, but Medicare paid for it and they're going to keep getting paid for it. So there are many types. These are just a few types of Medicare fraud. One is ambulance. There's a lot of fraud with COVID-19, home health care, medical identity theft, nursing home, prescription drugs, and more. So one of the things that I do like to talk about is ambulance fraud. Most people, if they need an ambulance, it's obviously a pretty bad situation. And someone calls 911, you get in the ambulance, you go to the emergency room, and come home, and sometimes later you get the bill. Most people only look for their copay. They know that with their health insurance plan, they have to pay $50, $250, $400, whatever it might be. But nobody really looks to see what they were billed for. So I always recommend that people literally look at the bill. How many miles did they charge you to get to the closest facility that you went to? So that you know, if you only live 8 miles away from the nearest hospital, that should only say 8 miles. It should not say 150. You also should know that if you fell and broke your arm and you just needed a ride to the hospital, it's called basic level of care. But if you're having a heart attack or some kind of head trauma, something very, very serious, it would be an advanced life skill. And they bill at different rates for the type of care that you receive. So I always tell people, take a look at what it says. Are you ALS or BLS? Because they charge more, obviously, to have a paramedic on board working on you than they do to have an EMT who's just helping you with the gurney and with treating you for your broken arm. So just be aware of that. That is something we do need to look out for. The other one that I always mention is medical identity theft. Once a Medicare number is compromised, it can lead to medical identity theft. And I have a perfect stat example to share with you. I received a phone call, and this was probably 14 months ago, from a woman who called and said, "Hi, my name is, I'm 92 years old, and do I sound dead to you?" And I'm like, "No, you don't." And she said to me, "Well, Medicare says I'm dead." And I said, "What do you mean?" She said, "Well, I read my MSN and they denied a service because it says service happened after date of death." So I was like, "Oh my Lord, something happened and now they're saying that she's dead and she's not." So the first thing we did is we called Social Security because that was her only source of income. And we wanted to make sure that they did not stop her monthly checks while we cleared up the rest of the situation. So we were able to call Social Security. We were able to verify that she was still alive, and everything was good. So they didn't stop. Luckily, it was before everything was stopped, and so she was able to continue getting her monthly money. But then we had to deal with the hospital and the ambulance company. So with the hospital, somebody gave her ID and used it for her stay in the hospital. And this lady literally went to the hospital via ambulance. The ambulance company got the Medicare number from the hospital. The lady was in the hospital for 10 days and unfortunately, she passed away. Now, we do know, excuse me, that when she was in the hospital, because this is one she had never been to before, and one that her doctor was not affiliated with, that they called and got her medical records. So there's some concern about how did they treat this person based on the other person's medical record that they were looking at. So it's a little bit of a concern, but we were able to work with the hospital, Medicare, and the ambulance company to prove that she was still alive and that was not her that needed the ride to the ambulance and then passed away 10 days later in the hospital. But I will tell you, 13, 14 months later, we're still dealing with her medical records and making sure that the correct medical records are in the hospital and with Medicare, so that with this lady, the person who's still living, this now 93-year-old, is going to receive the proper care if she ever has to go to the hospital. So it's been a long, long time that we've been working on this. It's still not 100% accurate. I'm hoping that by the end of this year, we can say that her medical identity has been cleared and she will, if something were to happen, get proper medical treatment in the hospital. So today I wanted to talk to you a little bit about some old scams, but the latest tactics. So genetic testing has been around for a while. And pre-COVID, people were going to senior events, fairs, anything that was going on out in the community. And they were telling people that for genetic testing, Medicare approved, Medicare will pay for it, don't worry about it, cheek swab, and we'll send you back your results. And these were to see whether or not you had cancer or if your medications were working with your body, if you were on the right pills for yourself. And a lot of people were giving their cheek swab and then finding out later that Medicare does not cover these tests. Now they've decided that they're out there and they're calling people because, we're not really out in public that much anymore, that they have added cardiac genetic tests to the mix. So this is to find out if you have any kind of heart problems, family history, whatever it might be. So the reality is that when people are getting these phone calls or even postcards in the mail, these are all scams. There is only one preventative genetic test that is covered by Medicare, and that's a colonoscopy. And we all know that colonoscopy is not a cheek swab that you give at a vendor event. It is something you prepare for. You go to the hospital and they do their test, and you need someone to take you home because of the meds they give you. So it's definitely not a cheek swab at a vendor fair. Durable medical equipment scams have been around forever. They used to be on infomercials on late night TV. They used to send postcards to people about calling and getting their free durable medical equipment. And now it's primarily by phone. But one of the new things that they've been doing is basically just sending boxes of bracelets to your house without any warning, without any phone call. And then in the boxes, they have forms that they want you to sign that say you basically received and are financially responsible for the braces. And that if you want, you can call the company and give them your secondary insurance information. This is because they already have your Medicare number. It's on the form. And we don't want you to sign the forms. We want you to call us, and we will help you get through this. They're also now faxing doctors' offices. They're faxing over a script for a doctor to sign for this medical equipment. So fortunately, a lot of doctors' offices are aware of it, and they've been calling us and letting us know so that we can work with the beneficiary to get this fixed. So the other one is the new Medicare card scam. And scammers are calling to ask you personal information so they can issue you. Right in the beginning of COVID, it was a chip card like you would use at the bank, and there are no chip cards. And the new one is a black and white COVID-19 Medicare card. There is no black and white COVID-19 Medicare card. The one that you have that changed to a computer-generated mix of numbers and letters is your Medicare card. There are no new Medicare cards in the works anywhere. So one of the reasons I like to talk about all these scams is they're all part of a bigger picture. So we might be seeing genetic testing here in New York, but the same company is doing genetic testing in Florida or Nebraska. So everything is just not happening in our neck of the woods. It's happening in Puerto Rico, in the Virgin Islands. And it's important that we report them so when this information goes off to all of these strike forces, which I'll talk about in a minute, they can put all that information together and make an arrest. So there are many strike force teams, and it consists of the Office of the Inspector General, the FBI, Department of Justice, offices of the U.S. Attorney, and local law enforcement. They have shut down many healthcare fraud schemes around the country, arrested more than 1,000 criminals, and recovered millions of taxpayer dollars. There are currently 15 strike force teams, and one is right here in Brooklyn, New York. In 2021, there was a COVID takedown. This largest coordinated law enforcement action was to combat healthcare fraud related to COVID-19. The scammers were offering Medicare beneficiaries the COVID-19 test and then using their Medicare information, their number, to bill for additional unrelated tests that are medically unnecessary and more expensive. 14 defendants were charged, covering 7 federal districts. 50 plus medical providers received adverse administrative actions for involvement in the scheme, and it equaled over $143 million in false billing. That's a lot of money. So what's going on now with COVID? We have telehealth fraud, contact tracing, COVID-19 survey scams, and the vaccine card scam. I want to talk a little bit about telehealth. Pre-COVID, it said that there were about 15,000 beneficiaries each week who received a Medicare telemedicine service. During COVID, Medicare added 144 telehealth services. And then, as you can see, between March and October, there was over 24.5 million beneficiaries who received a Medicare telemedicine service. So as you can see, telemedicine really exploded in numbers, and for good reason, because, nobody really wanted to go to the doctors during COVID, to be in a crowded emergency room or doctor's office waiting room. So it was really a beneficial service. Unfortunately, it led to many more scams where people were getting phone calls saying, "Hello, this is your doctor's office. We would like to schedule an appointment with you. Can you verify your information?" But they didn't say what doctor's office. They never do. And we want people to be careful. We want people, if they want a telehealth visit for themselves or their loved ones or friends, we want them to call the doctor, their provider, and schedule their appointment. So if you receive a phone call from someone offering you free testing, treatment, supplies, hang up as a scam. And do not give out your Medicare number. Your doctor's office already has that information. They're not going to ask you to verify it. So one of the ways to protect yourself from telehealth fraud is to review your Medicare summary notice and your explanation of benefits. We offer healthcare trackers that you can utilize to keep track of your medical appointments and then use it to see what's on your MSN. We've had people say, they've called in our office and said, "I did not go to this lab in, let's say, Pennsylvania. I didn't give a specimen there." And I will actually call and find out what's going on, or one of the staff members. And the guy, for example, that was adamant about Pennsylvania, his hospital is 2 miles away from the Pennsylvania line. And his hospital uses this lab in Pennsylvania for all of their specimens. But if I didn't call and I didn't find out, this man would have thought he was being fraudulently billed for a service that he swears did not happen. So it's important to be able to look at it, write everything down, look at it, compare your notes. If you don't understand something, call the provider, find out. If you're not satisfied with the answer, we want you to call us, and then we will look into it. So contact tracing was really big in the beginning of COVID. And it was obviously used to prevent further spread and or exposure. Many scammers pose as contact tracers, taking advantage of this opportunity to steal personal information, either by email, text, or phone call. So I know that contact tracing has slowed down, but with the new Delta variant, I'm thinking it's going to pick up a little bit again. So contact tracers will not ask you for money, your bank account, your credit card number. They will not ask you to click on a link, a text, or email, your immigration status, social security number, or a Medicare number. But they will ask you for name, address, age, or date of birth. I always tell people just give them your age. They don't need your date of birth. Whereabouts on certain days. Questions about your health related to COVID, not whether or not your knee hurts or your back hurts. things that would be more common for durable medical equipment, and questions about whether you experienced any symptoms of COVID. They will also tell you who to call if you are sick. They will also tell you who to call if you, let's say you have to quarantine, but you don't have any food, or you need a little assistance. They will put you in the right direction for the help that you need. The COVID-19 survey scam, this is not a Medicare fraud scam, but it's worth noting. People were getting emails about COVID-19 survey scams. And as you can see by the picture in the slide, these started out very generic because it just said COVID-19. And then the scammers started putting on Moderna and Pfizer. Moderna and Pfizer were contacted. They do not have a survey out there, and these are scams. So what they are, basically, this is more of a financial exploitation. So I want people to know, because I don't want anyone to click on the survey. So the survey offers you up to $1,220 to take this free survey. So I clicked on all the links, and so they ask you like questions like, are you planning on getting a vaccine? Yes, no, or I prefer not to answer. Which vaccine did you take? And then they had, Pfizer, Moderna, or I would prefer not to say. So you go on all these like 5 questions, and then it takes you to choose a page where you can pick to choose your prize. So I decided to do the iPad, and I clicked off after that. But the iPad was going to cost like $49.99 to have that mailed to my house. Unfortunately, one of the women that I spoke with actually wanted the iPad, already gave all her financial information, and as she was waiting to go to the next page, her computer kept stalling out. You had that little round button. It kept going around. And probably about 10 minutes, then she finally gave up. But in those 10 minutes, they had her charge card information, and she had 10 charges on her card that she did not do. Fortunately, she used a credit card rather than her bank card and was able to dispute the charges. But it's important that you look at these things, because the legitimate surveys won't offer money or gifts as a reward, and they always have urgency. Like take it now, do it now, and never give out your personal information, such as your bank account, credit card number, any information to people you do not know. And you can always check a link by hovering over them. If they're long and suspicious, don't click on them. Vaccine card scams are a very fast-growing scam right now. Many people were happy to show that they were vaccinated and went on Facebook with a picture of them and their card. And on that card is what? The information of your lot number, your name, and your date of birth. That's all prime information for anyone to steal, and that's what they did. I should let you know that fake vaccine cards are a felony to be in possession of. So if you know anyone who's doing it, you better tell them stop, rip it up, throw it out, because they can be prosecuted for that. So we found this out, that this was starting by an article in the Washington Post. Excuse me a minute. And it turned out that on eBay, there was a pharmacist from Chicago who claimed his eBay account was hacked and somebody else was using it, was actually creating these fake vaccine cards. He was selling them for $9.99. his site has been since taken down, but there are many other sites on eBay where you can buy for $9.99 a card that already has a lot of information and a date. It has the Department of Health and Human Services logo on it. That is what makes it a felony. And you can fill in your name and date of birth, and there you go. These cards are scary because they also put people who have been vaccinated at risk. Right now, I know that a lot of places are requiring you to show your vaccine card in order to go to events. I know when my husband went, I live in Western New York, so when my husband wanted to go see the Yankees were playing the Blue Jays, and he was like totally ecstatic. And the way this sitting was in the arena, or the ballpark, I should say, those who were vaccinated got to sit on one side. Those who were not vaccinated had to sit on the other side, but there was separation. But if people had that fake vaccine card and said they were vaccinated and they weren't, they were sitting with all those people who were vaccinated in a much more crowded area. So just be careful about what you post on social media because people are looking to steal it. Right. So if you believe that you've been part of a Medicare fraud and abuse scheme, we want you to call us at our toll-free number, 1-800-333-4374. All our services are free and confidential. I'm always looking for volunteers who like to make group presentations or distribute information to their community, and there is a slight process to that. And you can always, once again, contact us at New York Statewide Senior Action Council. You can visit us online at www.nysenior.org. Or if you are interested in training speakers, volunteering with the program, or to report suspected fraud and abuse, once again, you can call us at that 1-800-333-4374 number. So, yeah. Open up to questions, Kara?
Yeah, all right. And so just so you all know, I did put a link to Beth's survey after the presentation. It's in the chat group, as well as I'm putting a link where you can locate on S&P's website your state-specific office. So specifically, if you click on New York, that's where you would see Beth, but they have all the different states in U.S. Virgin Islands, so you're able to click on there and see which office that you would report to. So right. I do have a first question, and what I'm going to do is, if Beth, you want to keep that back on the question screen. Someone asked if they did post their vaccine card information online, is there a way to check to make sure that their vaccine information card wasn't stolen?
No.
No. Okay. I was going to say, I don't think at this point. Mm-hmm.
Yeah, at this point, it's too late. I think you can go delete the post.
Yes.
It's too late. Once it's up there, I mean, these people are constantly looking for information. Mm-hmm. So if it was stolen, then it was stolen.
Yeah. Okay. So I have someone else who asked if they're caring for their person long distance, what can they do from a long distance standpoint to help their person if they're not able to have access to their mail to check for scams or the phones or things like that? So basically, it sounds like they're not present for those day-to-day right. interactions where someone could, especially if someone has a cognitive impairment, could be susceptible to that.
Right. I honestly suggest going on Medicare.gov and creating an account with the person that you're caring for. That mm-hmm. in real time what is being billed to Medicare.
Mm-hmm.
That way you could be able to look at it and say, yes, they went to the doctor. Yes, they take these medicines. Yes, they were at that particular lab for a blood draw or whatever. Financial exploitation is obviously much harder.
Yeah. Yes.
That is something that I think there are services that you could use, like on your checking account and whatever.
Mm-hmm.
Because right now I'm drawing a blank and I'm really sorry.
Oh, that's okay. And I think it's like you said, it's like getting to know who the stakeholders or entities that are around the area. So if it's the local area agencies, the local high cap counselors, right? SMP, these are the people that we can get connected with, especially if they provide case management services. Sometimes there's other services that will be there to help. Specifically go through anything. Just as a simple example, in a previous line of work, I worked at a NORC, and at this NORC, in this position, people would just randomly bring their mail up to me. They, and that was the trust that was built if they felt like report wise, as I was a social worker staffed. So they would be like, Kara, this is like, I think this is a fraudulent. So what I would be able to do is be able to go look up at the internet, match the information that was in the letterhead of a letter, and then match it to what the closing information was, and it didn't match up.
Yeah. I mean, those are the things, unfortunately, if you're not right there, that you're going to need to use. I think it was called LifeBlock. Is that?
LifeBlock? Yeah, there's that one. There's also Silver Bills, I think, too.
Right.
That's definitely something if you, Beth, of course, if you have the link for that before I send out the email to everyone later with all the slides and information, I can attach it to that email too.
Okay. So I just think there are some things you can do from afar, and other things, unfortunately, even if you were near, you just might not be able to control that situation, check on it anyway.
Yeah. I do have another person ask lately. Oh, I don't know if you've seen this before, or not, Beth, but they said they've been getting text messages of spam, but it's like multiple numbers. It's like 20 numbers. And then what they used to do is when they got a spam text or a call, they would like block it. But now that it's in a group setting, they're having a hard time blocking it because you have to go through each individual person in that group. Have you heard anything about this at your office?
No, I haven't. This is the first I'm hearing of it. I'd love her to email me more, he or she, more information about that.
Definitely. And I'll put Beth's information in the email, so that's something you can definitely follow up with on that one in regards. So this is something to be important to pay attention to is, right, the different level of scams we're seeing. There's some new ones, and this is where Beth in her position, right, is able to learn about the newest ones that are popping up and inform us about different things that we might not be aware of that are ongoing. And it's not just a state-by-state basis. This happens all over the world. And so there's just different tactics. So it can be a scary thing sometimes, because I think you mentioned this, Beth, where it can feel a little shameful to feel like you got caught in a scam. But it's important to know that when you do share it with people like Beth, then you're able to bring awareness to it, and then that might actually help them to know what to focus in on, and then from there they're able to investigate it more, and that's a way that it can help other people not get scammed when you bring it to attention.
I would like to just let you know that I have had people of all levels of education, all levels of income, who have been scammed. And they all feel pretty much the same thing, that they just can't believe it happened to them. Scammers work hard at tricking people. They're very good at that. They sometimes catch you when it's like you're totally off guard. I was getting phone calls at like 6 and 7 o'clock in the morning. And she'd wake up to these phone calls, and eventually she just gave out her info. It's sometimes it's the timing, it's what's going on in your life, and Being caught off guard.
Yeah.
Tell me, I was waiting for my wife's doctor to call. I thought that was who it was. All this information.
Yeah, and especially like you said, if you get caught off guard in that early mornings, I think that's something everyone can relate to. And you get a phone call, you might just answer it for the sake of answering because it keeps ringing.
Right. So we know that this is nothing to be ashamed of or embarrassed. These scammers just work very hard at scamming you. And that's their job. That's how they earn all this money. And they also befriend you, they trick you.
Mm-hmm.
Tell people, look, if you don't answer the phone, get an answering machine. The best you can do is screen your calls. So if there's any doubt as to who's calling you, they're going to leave a message. This is your daughter, your son, your neighbor, your doctor's office, whatever it might be. They're going to leave a message. Scammers are not going to go through all that trouble. They're just going to keep calling you, and they're going to work you over. I had a gentleman who was a veteran. He kept engaging with these scammers, and I kept saying to him, why? Well, I don't know why they don't stop calling me. I tell them to stop calling me. I said, because they're not gonna. This is what they do. Well, one day they called him, and he was on his way out the door to go to an appointment at the VA. He said, I don't have time to talk to you. I have an appointment at the VA. Well, guess who called him later that night? Someone pretending to be from the VA, and the man donated the money, gave it to him over the phone, and that was the end of the time he heard from a scammer. So you accidentally give out information. You need to do it on purpose. You're caught off guard, you're in a hurry, you want to end the phone call. Or I've even had people tell me, I just want to tell these scammers off, and I'm going to give them mine. Well, they also give your information to other scammers, so you're going to continue to get called. So the thing to really do, don't answer the phone. Let the answering machine pick it up. You can always check later.
Yeah.
Or, man, you can check while they're talking.
Exactly. And I have someone who actually said, because it's funny you mentioned this, they said that for what they do for their dad is what they made it so that way he runs by the calls by the son. So that's something to set up in communication sometimes. If you do have concerns about your loved one, getting scammed is, it can be something where it's, let me just run it by this person. Or again, like you said, not answer it. Many of the devices we're seeing for even just phone systems for older adults, and if any of you have loved ones with a cognitive impairment, is the phones that limit the amount of people you can call, where it has pictures of people.
Right. So I love that phone.
Yeah, that way they know who's kind of calling, and they know that, well, this person may or may not call. And if they are in a facility in that regard, it could be something that if you're long distance, you could mention to the care director or someone just to be aware of that. Maybe there's been a tendency in the past to fall for scams, that we should just, be careful and watch out.
Right.
I had someone who also mentioned, I guess this happened to this person too. The multiple phone number has happened to this person as well. And what they've done is just delete and gone into the message to block. Yeah.
Oh, okay. I'll have to take a look at that, but yeah, thank you.
Yeah. I have someone else who says, great information, Beth. This is so good to review regularly. Thank you for presenting on this.
You're very welcome. Thank you for attending.
Of course. I have another person who asked, let me just spread out the screen so I can see the question. Is there someone that can review Medicare summary notes with me if I don't have family members? This is something that could they call the S&P office, Beth, I think, right?
They could call us. We'll be more than glad to help out with that.
Yeah. And sometimes you can also check with, you can call Medicare directly as well if you want to review certain pieces of it as well. I have someone else that says, thank you very much, Beth. Excellent time and timely information. I couldn't agree more, especially with things that we're seeing happen throughout the pandemic. And And it's good to bring awareness to, so this way people know, be careful with your vaccine cards, be careful with people showing up to your doorstep if they're offering free tests or things like that. People won't do that.
Yeah.
I have someone else, thanks again for the tips on dealing with the scammers. This is very helpful. Good, I'm glad. And I think
I'm
this is
glad
what it's
too.
about.
Well, I thank everyone for attending. Maybe we'll have more information next year for the end of next year, and we can come back and visit again with the latest information. I would love to tell you that there's never going to be any more latest information and that you won't ever need to hear from me again, but I know that that's not true. So maybe we'll take a look at it again for sometime next year to see what the newest ones are that are out there.
And I appreciate, Beth, you being here with us today, because I always think these conversations are helpful to allow people to be more open about different things that pop up and just bring more awareness about different things we can do ourselves to try to be protective, but focusing on what we can control instead of what we can't, because some things we might not be able to, and that can be hard to get past those feelings. But if we focus on what we can control and limit the amount of information we're giving out, that can reduce, right, our rates of how we get spammed / scam. I don't know why I said spam.
That's what it feels like, though, doesn't it? You know, your spam folder instead of it's always amazing to me the newest twist that they put on an old scam, or how they just break out a little bit more. And getting the information out is so important, because even if this has not happened to you, maybe it happened to someone else that you knew or know, I should say. And if you even just mention it to someone, it might balloon into like, oh my God, I gotta tell someone else this, or I gotta do this, or whatever. And maybe that one person, or maybe 5 people, all have done this. And like I said, call our office. We're here. We're gonna help you out. We're gonna do what we can to spread the word so that at least what we know is going on out there, we're gonna try and stop and inform people so that this doesn't happen to them.
Yeah. And while you were sharing that, and I think this brings up a really good point that we've kind of been discussing. Again, someone said, thank you. This is really good information. And it's really at the same time scary for seniors. This is a very vulnerable type of, I would say, financial abuse and exploitation that someone can go through, especially if you're already feeling vulnerable. To have something like this happen, it can be, detrimental to your self-care and and as well, I shouldn't say maybe, and your self-esteem. So anytime someone approaches you with this situation, I think that that's great that they trust you to share this information with you, and just reassure them that, this is something that can happen. This is what we can do, and allow them to express their feelings about the whole situation that occurred.
Definitely.
Well, thank you again, Beth, for being here today. We'll wrap up, and I will be sending out an email with the information to where you can locate your office, as well as the survey for Beth's presentation. And I'll be sending that out shortly with the information.
Thank you. Thank you, everyone.
All right, everyone, take care.